For the second half of our morning session, to kick things off, we have Dr. Don Ritter, who's a board-certified poultry veterinarian who has worked directly for broiler production companies on the Delmarva Peninsula during the past 33 years. And for the last 23 years, he's worked for Mountaire Farms, the 6th largest U.S. broiler company. So today, to talk about a new label on the table, One Health Certified program, let's welcome Dr. Don Ritter to the stage.
All right, good morning. I'd like to thank the program committee for this opportunity, and I know I'm kind of preaching to the choir here, right, because we have a lot of agriculture folks in the audience, but I really enjoyed that consumer panel this morning. I thought that was very, very well done, and I thank the committee for that too. But so I'm excited today to introduce a new consumer choice label that'll be a certification program for multiple proteins. So it'll be an umbrella program that can apply to all proteins and hopefully go across the protein supply chain or across the meat case. And in our view, the program is going to offer a better choice to consumers than the current other label options. We think that the program, and the name of the program is called One Health Certified, and we view it as a triple win program. It's a win for the animals, for sure, it's a win for people or consumers, and it's a win for the environment. And also the bonus win is that it's a continuous improvement program. So we're going to start somewhere and strive to get better. So the goal is to reduce consumer confusion and to create a practical and meaningful certification program that at a minimal cost premium. So food security is also an important concept for this program. We don't want this to be meat only for rich people. We want it to be a consumer choice label that appeals to all people. So kind of with that said, my talk's over. So I want to tell you a story about how we got here, okay, and why we became involved in this project. Okay, hit the button. Nothing's happening. Okay, forward. I'm hitting the button, but okay, now it's moved 3 slides. Okay, let me back up. Okay, now it's on. All right, sorry about that. All right, so I'm going to start with a little bit of background information because I want everybody to be on the same level of what we're talking about with some of the technical things. And then I'm going to talk about current meat label options that are out there. And I want to talk about some consequences if you remove all the antibiotics from the system. Okay? And that's called No Antibiotic Ever programs, or NAE is the common term. And then I'm going to review what, in our view, is a better solution to this problem. So again, a brief background about me. I'm a chicken veterinarian. I've been one my whole career, which is 35 years. I've worked for 2 companies. One chicken company for 10 years, and when that company got purchased by another company, I changed jobs to a second company. And I've been at Mountaire Farms for 25 years. And a lot of you haven't heard about Mountaire Farms. We're the 6th biggest chicken company. I think we'll be the 5th by the end of the year. Our new plant just opened in January in North Carolina. But Mountaire is non-branded, so there's no product sold that says Mountaire on it. So there's 3 plants that do wholesale meat, and then there's 1 private label tray pack plant. So it'll say Aldi or Safeway on it, but it won't say Mountaire. And our company practiced conventional production practices until the end of 2016, and then we switched over to a responsible antibiotic use program. All right, we're going to start with antibiotics. Antibiotics are a critical shared resource, and they're shared between people and animals. And there's two buckets of antibiotics. One is called medically important antibiotics. And we're talking about medically important for people, okay? So these are drugs that if you get ill and you go to the doctor, they're important to your health. And they're also important to sick animals. And they're ranked. So all medically importants are not equal. Okay, some are critically important and some are less important in human medicine. But they're the same. So if we treat chickens with penicillin, it's the same penicillin that your child may get for an ear infection. Okay? They're medically important. The second bucket is called non-medically important. So they are either used only in animals or they're not deemed important to people. And now, generally, the non-medically important antibiotics are only effective as prevention when used in animals. So they're not used to treat sick animals. They're used to keep animals from becoming ill. Okay? All right, the next thing I'm going to talk about is antibiotic residues. So what are residues? They're trace amounts of antibiotics that may remain in the meat after an animal is treated with antibiotics. Now, FDA rules and laws prevent harmful levels of antibiotics remaining in the meat at time of slaughter. So all the products used in animal agriculture have to be withdrawn according to their label to make sure that the meat is safe to consume. So no meat is sold that has harmful antibiotic residues. Okay, so that's an important thing to know. And then we're going to talk about AMR. Hang on a sec. Antimicrobial resistance. So that is a bacteria that is resistant to one or more antibiotics. And the concern is that someone is going to acquire a foodborne illness. So they may get a salmonella infection from consuming meat or eggs or poultry. And they're going to go to the doctor. And they're going to get treated. And the antibiotic they get from the doctor, the animals where that bacteria came from may have been treated with the same antibiotic. So then it would be a treatment failure from the doctor. And so that's the concern. Okay, the concern is that we may create some resistant bacteria on the farm that ends up infecting a person, and they have the same antibiotic treatment that doesn't work as well. Now, there's been a lot of risk assessments about that likelihood of that happening. It's very low, and they range. Often they're in the range of getting struck by lightning. Okay? So it's not likely to occur, but it can occur. And for that reason, all users of antibiotics need to do their part to preserve their effectiveness for now and into the future. And this is a big deal. The UN had a summit on AMR in 2016. The only other time the UN had a summit on a non-military issue was on HIV. Okay? So that's how big of a concern globally AMR is, especially in undeveloped countries where antibiotics are readily used and overused. Not so much in the US. Okay, two more background slides. I want to talk about certification strategies or certification systems, and I'm going to talk about package-based versus a system-based certification. So the package-based approach means that it means the meat in that package was raised according to that label. Okay, so let's take no antibiotics ever. You start all your animals out with no antibiotics, If some get sick, you treat them. Once you treat them, you can't put them in that no antibiotic package anymore, right? So they don't qualify for the mark. So you have to divert them and put them in a different sales stream. Okay, so that's what I call a package-based diversion program. Now, a systems-based approach is you raise animals under a set of rules or guidelines. Rules about how antibiotics are used, rules about welfare, rules about vet care. And all the animals raised in that system are eligible for the label. And so therefore it doesn't require diversion of product into a second product stream. And that results in a reliable supply chain for our customers. So package-based versus systems-based. Now, I have a question for the audience. Show of hands, who has heard of the term One Health? Okay, so about half, okay. Our consumer research says 40%. So we're about the same. So what is One Health? One Health is the concept that the health of animals, people, and the planet are linked together or inseparable. And then people still kind of look at you and then you say, well, you know, the way we raise animals can affect the environment. And people start nodding their head, they go, oh yeah. And the way we use antibiotics in food animals may affect human health. And they go, oh yeah, okay. So a program based on the principles of One Health tries to balance these concerns and create optimal outcomes for all three parts of the system: the people, the animals, and the environment. Okay, so that's the One Health concept. All right, I want to talk about current meat labels, and I think that choice in the marketplace is good. I mean, if we want to raise chickens in this room, and if somebody will pay us enough, then that's okay. I don't really see the value proposition there, but you never know. Judgment is bad, and I think judgment has entered into this space, unfortunately. So I think a better outcome is to provide transparent information to customers so that they can make up their own mind and make an informed decision. And I think you saw this morning that we're not doing a good job of informing our customers to allow them to make their own choice. So I view animal production programs as a pendulum that swings back and forth. And on one side, you have conventional production. That's the way we all raised animals 25 years ago. And I call that a dated program, less accepted in the marketplace. On the right-hand side, you've got no antibiotics ever. That'd be an extreme program. Well, we're going to take everything out, and we're going to raise them that way. And then in the middle, you have a bucket of responsible practices or a more balanced approach. And there's retail labels for the extreme program, and there's really no labels for anything else. So we don't differentiate between a responsible producer, maybe that has some rules around antibiotics, versus one that doesn't. Okay? So the current meat labels are very confusing. And it's becoming a beat your chest thing and write more on your label than the other guy. You know, producers are trying to write books on labels, and in the upper right-hand corner it says chicken wings. You know, and it's just getting out of hand. And many of these are absence labels. I'm going to talk about that in the next slide. It's not quite got this far, but I don't know where it's going to stop, to be honest with you. So what are absence labels? Where absence labels describe a practice or ingredient that was not used or is not included in the product, and that implies that attribute may be in packages that don't have the absence label. So, for example, if a package of eggs says cage-free, then that means that those eggs were produced by a hen that was not in a cage. It implies that the package that doesn't say that was in a cage. Well, in meat chickens, people are using cage-free also, and they're putting cage-free on a package of chicken meat. Well, no chickens raised for meat are raised in cages in the United States. But if you see that cage-free on a package of chicken, you're thinking, well, that other package must have been raised in cages because it doesn't say that. So many of these labels rely on misinformation or consumers' lack of knowledge about agriculture. You know, only about 1 to 2% of America works in any kind of agriculture now. And so folks just don't know. Now, all labels of meat have to be approved by the government. So if you're going to make a claim on a label of meat, you have to verify that you meet the requirements to put that on your package. And normally, where USDA Agriculture Marketing Service is the one who verifies these claims for each individual producer. All right, this is just some examples of antibiotic labels. There's 18 of them on this page. No wonder people are confused. All right, does anybody care? Well, you need to look at unaided consumer surveys if you're going to really try to find out. And by unaided, I mean that you ask consumers, what are you concerned about when you buy chicken? And they list what they're concerned about. And three things come to the top all the time: price, safety or freshness, and taste. Okay, those are what consumers are concerned about. I think we heard it up here in the panel. But 20%, a growing minority, are concerned about how chickens are raised. Okay, and I'm sure that skews to a younger generation. And it's something we need to be aware of. So there you go, I had to click through there. All right, so now I'm going to switch over and talk about NAE programs, no antibiotic programs, and where this is a one-dimensional program. So the only thing in this program is that antibiotics are not used. Not medically important, not non-medically important. No antibiotics, easy to understand, nothing was used. But the program has unintended consequences. So what are they? All right, as I said, this is this is the most common animal production meat label claim currently. Half the consumers believe that packages that don't say NAE contain harmful antibiotic residues. So they're worried about eating antibiotics. Okay? And I've shown you earlier that this is a false assumption. Okay? This is simply not true. And the concern about AMR bacteria is really poorly understood by consumers because it is a complex problem. Again, this is a package-based certification. So it means if you treat them, you got to divert them. And that creates competing priorities for the producers. Do we maintain the NAE label, keep them in the box, or do we treat animals, but then we can't put them in the box, right? So those are competing priorities. So I want to talk about how antibiotics are used in animal agriculture. And we're talking about medically important drugs only in the middle column here. So in conventional production, They have high medically important drug use because they're really not following any kind of restrictions. They're using what's legal to use, is not harmful, it's just less accepted. The health outcomes of those animals are normally high. A responsible drug use program would limit medically important drug use just to treat ill or sick animals. Okay, they're not going to give them to all the animals. And the outcomes are normally high for them also because they're using the non-medically important drugs to kind of keep the animals healthy. Okay? And then the no antibiotics ever folks, of course, they're using no antibiotics in the ones that bear the label. Their outcome is moderate. And of course, their use is going to be high in the ones they have to divert, right? Because they all got treated, so they got to divert them. And their outcome is low. And so, how do we know this? How do we know that this isn't so good for the animals? Well, about half the chickens in the United States are raised this way now, and there's data available. So we have data trends that we'll look at in a minute. And also there was a survey done by Dr. Randy Singer at University of Minnesota last year, where he surveyed about 500 veterinarians responsible for no antibiotic ever animals. 42 of those were chicken veterinarians. Okay, and I'm going to show you the chicken veterinarian responses to his survey for two questions. So first we're going to talk about broiler mortality. Okay, it's not pretty. We don't want this to happen, and we want to reduce mortality the best we can. So this is the broiler mortality in the United States from 1925 to current. And you see a fantastic trend line going down below 4%. And then in 2013, the slope of the line changed. It started going up. And that coincides with no antibiotics ever becoming more volume of the production space. And if we drill down into that slope change a little more, it's really quite dramatic. So the mortality in 2013 was 3.75%. Now it's back up to 5% and climbing. Okay? The slope and the trend is not good on mortality. So they were asking a couple questions. How does NAE impact the health of the broilers? And 13 of 42 said it makes it significantly worse. 16 of 42 said it makes it slightly worse. So the veterinarians caring for these animals agree it makes the health and welfare of the animals worse. Okay? Which the data supports. And then the one other question, and I quoted this exactly because I didn't want to misconstrue it. So the question was, he asked 42 vets, do you agree or disagree with this statement? There are times that maintaining an NAE label has priority over animal health and welfare. So, as a veterinarian who took an oath to care for the health of animals above all else, you want this, answer to not only be no, but to be hell no, right? Of course the animals come first. Well, 22, over half of the veterinarians responsible for these animals, either strongly agreed or somewhat agreed that there are times where keeping them in the box is more important than taking care of the animals. This is troubling. This is not good, right? So, and I don't want to be a Debbie Downer. I know it seems like all hope is lost right now. Well, it's not. So I think there's a better solution to this kind of quandary we're in. So the hope is that somewhere somebody's going to do something, right? We're all kind of waiting for something to happen. But, you know, what if there was a transparent, positive retail label alternative out there? And so the goal then is to create an animal production standard that has meaning and value. And there's an ancient saying that says perfect is the enemy of good. And I've kind of changed that a little bit, that perfect is the enemy of better. So we don't want to, if we wait around to create the perfect animal production standard, we're going to be paralyzed and not start with a better one. Okay, so we're going to start better, and we're going to make it, we're going to improve it over time. So where we're, you know, like that's the goal. Now, not all good ideas are fun or easy to work on. All right, this is a picture of George and Shirley. They were married for 61 years, raised 4 children, and you guessed it, I was the second oldest child. In fact, there we are. And 2 years ago, my older sister called me and says, Donnie, she calls me Donnie, it's okay. She said, Donnie, it's our parents' 60th wedding anniversary this year, and we got to do a party for them and all their friends. And I said, Diana, I mean, come on. You know, like, you know, half those people can't drive. Some of them are in wheelchairs. I mean, come on. Really? It's a good idea that nobody wants to plan the 60th anniversary party. But of course we did it, and it was a success. And you know, creating a whole new animal certification program is kind of like the 60th wedding party. Okay, it's a good idea, but finding partners is kind of difficult. You know, everybody wants to be a pioneer until you get an arrow in the back, right? So it's challenging. So we formed a coalition, though. And we found some incredible partners that were like-minded, that shared a vision to create something better, right? You know, we knew we couldn't do this alone. We needed a lot of help from a lot of different areas. So we started with 3 animal production categories. Chicken, turkey, and pork that are kind of vertically integrated, where folks could kind of get their arms around the whole system. Partner with nonprofits, university scientists, ran this by all the government agencies, stayed in touch with them, got advice from them, and also talked to 36 leading retailers and wholesalers and restaurant chains to get their input. So we tried to create this group, and they've worked together for over a year to produce a program that'll be launching soon that's called One Health Certified. It'll be an umbrella certification program based on the principles of One Health, animal well-being, antibiotic stewardship, and environmental impacts. It'll be a system-based certification that won't create 2 product streams. And it'll be an open certification program available to all producers. And compliance will be assured by government audits through the Ag Marketing Service. Now, as I said, the program is going to start in chicken, turkey, and pork. We hope to expand to dairy, beef, and eggs. So that's how it's going to start, okay? So I don't want to misrepresent that. All right, what's in One Health? 5 core principles. Disease prevention, we want to keep disease out. We want to provide excellent comprehensive vet care. Responsible antibiotic use means there's going to be restrictions on medically important drugs. Third-party audited animal welfare program, and we're going to measure and report environmental impacts and have waste management programs for each farm also. So those are the 5 things. And I'm just going to kind of flip through these and stop on a couple of them. The vet care plan has become very complex and comprehensive. And I want you to see like the 5th thing on this slide. It says action thresholds that require notification of the changing health status of animals to a licensed veterinarian for prompt treatment. So this program has a threshold. So when a line gets crossed, those animals have to be taken care of by a licensed veterinarian. So there's no slippery slope like the NAE programs waiting to treat them to keep them in the box. Okay? In fact, our program does the opposite. It requires you to treat sick animals appropriately and promptly. And I'm proud of that part of the program. The antibiotic use, again, the restrictions are on medically important drugs as listed by the FDA. They're used to treat and control disease. They're not used for prevention, not used in a regular and repeating manner, and they're given to the fewest number of animals necessary. Also, treatment outcomes are going to be measured. Like that's something new. And we're going to have detailed annual reporting of antibiotic use. Also, this is the first certification program that looks at environmental impacts. And we're going to start with measuring where we are and data collection, and then in future versions we'll set some benchmarks to reduce our environmental footprint. And we're going to do that by doing a life cycle assessment, and that measures the carbon footprint of the entire animal production system. And we're going to use the FAO GLEAM model, which is Global Livestock Environmental Assessment Model. So this is unique. Other programs are definitely not looking at the environmental footprint. So one thing, we're not going to give another badge to people to put on their package. So we're trying to reduce badges, reduce the book, right? We're trying to take the book off. So that's not going to happen. So if somebody wants to put no cages and no antibiotics, none of that can go on a package that has One Health on it. Okay, it's One Health or nothing. It's not One Health plus XYZ. We're trying to take the book off, replace it with a logo that represents a transparent and audited program. So that's the goal. We've done limited consumer research about One Health. I just got a couple slides on that. It was 1,000 consumers. It was contract research. We had no idea how it would come out. One thing you want a label to do is reduce consumer concerns about buying your product. Okay? So the NAE label reduces concerns to these were attributes versus no label. There's no label in the blue, NAE's in green. The One Health label is in yellow. So the One Health label reduces concerns more than NAE. I think that was a good outcome. And so what do consumers think about the program? We're 80% like a multiple requirement program instead of a one attribute program. And again, the vet health plan was highly valued. Consumers want animals taken care of. And that's what this program does well. Also, half of the consumers are concerned about antibiotic use. And I think this program delivers that also. We did ask some value questions. If you show those 5 attributes of the program to consumers and say, would you buy this label? 83% of consumers says, yes, I would buy that label. But it's going to take education to get folks to understand it. Half of those people would pay more for the label. And of those people, they would actually pay more than NAE. But the goal of this is not a get-rich-quick scheme. You know, the goal of this is minimal premium. All right, we want this to be affordable for everybody. So the next steps are we're waiting for AMS to help finish up the audits on the chicken and turkey programs. and offer that program for certification. We think that'll happen within the next 60 days. The pork program will follow later this year, and then we hope to expand into some other commodities. But the people, this coalition who started this, are going to have to hand this off to an independent nonprofit to run this certification program into the future, okay? So a group of folks who wanted to make a difference started it, and we're going to hand it off to an independent nonprofit. When will products be available? I think this summer, safely. You know, I thought working with the government, I don't know why I thought it would be easy, but I thought it would be a little faster, maybe. But the timeline of industry versus government is a little different. Plus, the 6-week walkout didn't help us in the start of the year. But I think you'll be seeing this summer. So, in summary, the current landscape's confusing. There are negative outcomes for the animals in the NAE production programs. And I think that this new consumer choice takes care of the animals in a responsible and sustainable way, and is a triple win. It's a win for the animals, it's a win for the people, and it's a win for the environment. So I'll take questions now. Thank you.
Time for just a couple questions. So if you raise your hand, we have a couple mic runners. You're so good, you already have 2 questions. I don't even have to drag it out of them.
Thank you for your presentation. John Johnson with National Pork Board. I'm interested in the point that medically important would only be allowed to be used for treatment, not for prevention. Poultry is uniquely situated with a wide availability of ionophores that other species groups might not have. I'm curious as to your pork partners, how they viewed that aspect of this program.
Yeah, so the pork partners are working on the technical details of the standard, and you know, to start with, it's what definition are you using of prevention, control, and treatment. So we're going to use the UN definitions of those, and the UN definitions include control for clinically ill or infected animals, okay? So I think the infected animals is going to give the pork team the leeway to take care of animals that may have a maternal infection from the sow that's passed to the pigs, right? Like they may have a PRRS infection where they're immunosuppressed, okay? So they're an infected animal. So that falls in the control bucket. You know, it's not a prevention anymore. But that's nuanced, and we're still working on that. And we may not get all the way there in the pork standard as the initial draft, but we'll see where that ends up.
Jerry Moy. Don, you talked in one of the slides there about, let's call it transparency around antibiotic use. What's the vision of how that looks, and where would, say, a consumer be able to go and monitor a package that they're buying and has the label on it?
Yeah, so the standard and the rules, how the animals are raised, are going to be they'll be on a website. They'll be for, you know, anybody can read the standard. I think there's going to be some annual reporting, Jerry, you know, through the New York Academy that will.
By individual company.
We'll probably collect the data, probably report it as an aggregate to start with, and then see. You know, it's really up to the governing body to kind of figure that out. You know, but our goal is to be very transparent. You know, much more transparent than what's out there now. Okay, thank you.
Dr. Don Ritter, round of applause.